Hi, I'm Dr. Shirin. I'm an infectious disease physician at the Singapore General Hospital. So today I'll be speaking to 3 people and I'll be trying to explain vaccines to them. So the first one is a 9-year-old child. I'll also be speaking to a JC student and then a university student. Do you know what a vaccine is? What's a vaccine?
It's something like an injection.
That's right. So a lot of vaccines are given by injection, but some of them can be given directly to the mouth as well. Do you know there are things called germs that cause diseases and make us sick, right? So they're like bad guys, right? Bad guy germs. And our body has an immune system, which is like the army, which fights against these bad guy germs. So when you get sick, what happens is that the germs come into the body, and then our immune system, which is the army, tries to fight them off. So what a vaccine does is that it actually teaches our immune system or our body's army how to recognize these bad guy germs and how to fight against them. So if you get vaccinated, what happens is that if next time one of these bad guy germs try to infect you and make you sick, then our body's army, the immune system, will actually be able to recognize these germs and attack them and fight them so that you don't get sick.
Does it hurt?
Does it hurt? Well, if it's an injection, it hurts. It can hurt a little bit. It's just like a little ant bite or pinprick, but it doesn't hurt very much. And most of the time, the injection only takes a few seconds, and after that, you don't even feel any pain after that. Sometimes after a vaccination, your arm may feel a little sore. Like, if you've been doing a lot of exercise and then sometimes your arm feels a bit sore, but that usually goes away in like a day or so. Hi, Guangshan.
Hello.
Hi.
So what is an mRNA vaccine?
Okay, that's a good question. So as you know, in Singapore we've licensed 2 vaccines for COVID-19, right? So the one is the Pfizer-BioNTech vaccine and the other one is the Moderna vaccine. So both of these are mRNA vaccines. So mRNA basically it's a bit like the instruction manual for our body, for our cells. So what it does is that when we give you a vaccine which is mRNA, it's the instruction manual for the cells to make a specific protein. And in this case, for COVID-19 or SARS-CoV-2, which is the infection that causes COVID-19, what it's actually giving the instruction manual for is the spike protein. So I don't know if you've seen a picture of a coronavirus, the COVID-19 virus or SARS-CoV-2. It's actually like a ball with these little spikes on it, which makes it look like a crown. That's why it's called coronavirus, right? Because it's like a crown. And so what the vaccine does is it's not delivering the instruction manual for the whole virus, it's just delivering the instruction manual for that spike protein. And that spike protein is the one that you need where it actually binds to the cells so that the virus can gain entry into the cell. So when you give the mRNA vaccine, the body will actually use the instruction manual to make the spike protein. And once it makes the spike protein, then the immune system gets activated. And the immune system then learns how to recognize that spike protein and attack it. So in the future, if let's say you get exposed to SARS-CoV-2 or the COVID-19 virus, then your immune system says, hey, I've seen this spike protein before, and so I'm gonna attack it and stop it from causing infection.
Okay.
So I think the thing to know is that what the mRNA is doing is not giving you the whole virus, it's just giving you a part of the virus which doesn't make you sick. But it teaches the body's immune system how to recognize it and then get activated if you were exposed in future. Hi Yomrik, nice to meet you.
Hi Dr. Shirin, nice to meet you.
Okay, I understand you have some questions for me about the COVID-19 vaccine.
Yes, so recently I read in the papers that some elderly overseas unfortunately passed away after taking the vaccine. So can I understand the cause of this and what are the risks of taking vaccines?
Okay, so if you vaccinate a very large number of people, like hundreds of thousands or millions of people, which is what's happening overseas and in Singapore too, I mean there will be a proportion of people that will pass away, not because of the vaccine, but because of say whatever underlying illness that they have. So for example, if they have heart disease or a lung disease or they get a stroke. So the question to answer is basically whether or not people who get the vaccine are at higher risk of dying as someone who didn't get the vaccine. So is it higher than the baseline risk of what you would expect? And so far, with all the research that's been done, it's not been found that having the COVID-19 vaccine increases your baseline risk of death. So I think if you weigh the benefits and versus the risk of taking the COVID-19 vaccine, the benefits in this case far outweigh any risk that there may be with the vaccine, because it prevents you from getting sick, and especially for the elderly who are at higher risk of getting more severe disease.
Okay, so maybe the most important question that I think like the viewers and also myself would like to know. So if I take the vaccine, does it mean that I can travel overseas like as and when I am worry-free?
Yeah.
Hypothetically speaking, like if the borders were to open.
Yeah, I mean, I think if the borders were to open and then you are vaccinated, I think it would be alright to travel. Because we know that the current vaccines actually confer quite a good protection, good level of protection. I think both the Pfizer and Moderna vaccines have over a 90% efficacy in preventing COVID-19.
Okay. Yeah.
So I think we had a great discussion, and I hope I cleared up any misconceptions or concerns people may have about vaccinations. And thanks very much for watching.